So yesterday we had a patient walking in with a severe tooth pain and we suggested them to go for an RCT treatment, that is root canal treatment. But he asked me, is that very necessary to go for an RCT treatment? Why can't we just fill it up with a normal cement? So yes, we all have this doubt, right? So come, let's go into the topic today and know what is RCT and why is it necessary to go for an RCT treatment instead of a simple filling. So before going into the topic, we are manufacturing bamboo toothbrushes where we have multiple models and colors, and along with it we have a medical use brushes also where we have ultra soft, which is used to resist recession of your gingiva and abrasion of your tooth. And in all these brushes we have multiple colors, and to differentiate we have designs on it, so we can differentiate from one brush to the other. And we also have bamboo travel tube where we can carry brushes in it, and we also have a stand we can keep our brushes in it, and we have a bamboo tongue cleaner. And the purpose of using bamboo is to avoid wood as well as plastics. So bamboos are just grasses, so it won't affect the forestry and it won't affect the earth by using a plastic. So plastics actually won't get decomposed, but our brushes get decomposed in 120 days, and we can use this for 6 months. The plastic brushes we have to use it for just 2 months, but this we can use it for 6 months. And along with it we have a wax coating, so it is fungus free. So if you like to order, the link is in the description. You can check the catalog and order your brushes. So while checking the description, don't forget to hit the like button, and come, let's go into the topic today. So we all know a tooth is made up of 3 layers, and the first layer is called enamel, which is the strongest of everything, and inside that we have dentin, which is somewhat softer than the enamel, and inside that we have a soft tissue which contain nerve supply and blood supply. So our ultimate aim is to protect the pulp. And the ultimate aim of the bacteria is to reach the pulp and get the nutrition from it. So it starts grinding the hardest part called enamel, and when it reaches the dentin, it becomes easier for the organism to grind in to reach the pulp. So when the organisms like microorganisms start grinding the enamel, we won't feel any sensitivity or pain or any discomfort, because when it is in enamel, it is the first layer, so no food will get impacted, no irritations will be there, no sensitivity, no pain, nothing will be there, but you can visibly see the black marking on the tooth or enamel. So we won't notice it, right? So what will happen is it will reach the dentin, and when it reaches the dentin only, our sensitivity get increased. We will get sensitive to sweets, cold items, hot items, and all these things. So even that time we won't feel so much irritated to go to a dentist. So after that, when it reaches halfway through the dentin, we will start having the food impaction. The food will get impacted into our tooth, and we have to pull the food out. So at that time we will know we have a hole there. But that will be too late, and some people won't consider even that stage to go to a dentist. So even after that, they will prolong up to getting a pain. So when it reaches, or when it is nearing the pulp, we will sensitize the pain, and when the pain shoots up, we have to go to a dentist. And we all know, right, dentists are not so emergency sort of doctors, but when you really feel the pain of the tooth, you will feel the emergency situation of getting a dentist at the midnight. So at that situation only, we will search for a dentist and go for a dentist checkup. So when we go for a dental checkup, they take a X-ray and see, and we will be having a black marking like thing on the surface of the tooth, extending from the outer surface to the inner surface and coming back. So when it reaches the pulp, it is necessary to clean up your pulp also. So we can't just go through a normal filling like GIC filling or composite filling, whatever filling it may be, we can't do that in this situation. So we have to go for a pulpal cleanup. So when we doing a pulpal cleanup, and that is called as RCT. So RCT is very important, and we have to do RCT when you come for a dental checkup with a pain. So even then, when we do an RCT, and what happens is, after doing an RCT, the pulp is not there. We are taking all the infected pulp out. So the tooth will be hollow and no nutrition supply is there for the tooth. So when that tooth has no nutrition supply, we won't have the strength in the tooth surface or crown to withstand the biting forces or masticating forces. So at that time, it is necessary to go for a cap. So we have to put a helmet for the tooth. So something like if we are going and hitting somewhere by wearing a helmet also, the helmet will protect our head, right? Similarly, the cap will protect our tooth surface while masticating or eating or swallowing or whatever it is. The cap will take care of the force. So the inside tooth, which is not alive now, and that tooth is protected. So now how to avoid this RCT kind of mess which is going to happen in our tooth? So it is better to consult a doctor 6 months once or at least yearly once and get a general checkup by cleaning our tooth, and as well as going for a dental decay which is just starting up, to clean it and fill it with a simple material and finish it off. If at all not going for a regular yearly once checkup also, when you start feeling some hollow space or some discomfort in the initial stage itself, please visit a dentist and get your filling done so that you can avoid your RCT treatment. Or sometimes it gets much more worse where people won't come to a dentist even when we have a pain, and that will prolong up to grossly decay where all our tooth structure will get demolished, only the root surface will be left out. So even in that situation we cannot help you. Even by doing an RCT we cannot save the tooth, so we have to go for an extraction. So that becomes 2 times 3 times difficult for a person to have a hollow space when you smile, right? So we have to protect our tooth at least from now. So if you like this video, please do like, share and subscribe to this channel. And if you have any suggestions, please leave it in the comment section.